Eating disorders. Etiology includes biological factors, which are genetic vulnerabilities or neurochemical changes. Developmental factors include struggle for autonomy, overprotective families, body image disturbances, or separation difficulties. Family influences include family dysfunction or childhood adversity. Sociocultural factors include media and pressure from others. Cultural considerations are most commonly in the United States, Canada, Europe, Australia, Japan, New Zealand, South Africa. It is less frequently among African Americans in the United States and equal among Hispanic and Caucasian women. For assessment, you would assess the patient's history, general appearance, mood and affect, thought process, self-concept, and their relationships and roles. When assessing a patient with anorexia, their patient's history would usually be model child with no troubles and dependable. Their general appearance would be slow and lethargic. When assessing a patient with bulimia, their patient's history would be eager to please and conform, and they would also avoid conflict. Their general appearance would be not unusual. Anorexia is the refusal or inability to maintain a minimally normal body weight. There is an intense fear of gaining weight or becoming fat, a significantly disturbed perception of body shape or size, the inability or refusal to recognize that a problem exists. The onset is between 14 and 18 years old. There is usually a denial early on, accompanied with depression and isolation. Anorexia may lead to extreme medical complications such as amenorrhea, constipation, overly sensitive to cold, hair loss, dry skin, dental caries, pedal edema, bradycardia, enlarged parotid glands, and hypothermia, and an electrolyte imbalance.
Hello, my name's Felicia, and I'm 18 and I suffer from anorexia. This is a day in my life.
Oh my god, Felicia, that test was so hard.
I know.
Do you want to go get something to eat?
I would, but I just really have to get home. Maybe next time?
Okay.
Bye. I look so fat. I really should just stop eating.
Bulimia is a recurrent, secretive binge eating episode that has compensation behaviors to avoid gaining weight, such as purging, laxative use, diuretic use, anemia use, fasting, and excessive exercise. Patients feel guilt, shame, remorse, and the patient is usually of normal weight. Bulimia usually has the onset of 18 to 19 years of age and occurs usually during or after diet episodes. Bulimia can affect your body in many ways. You can go into depression, the fear of gaining weight, anxiety, dizziness, shame, low self-esteem. Your cheeks can become swelling or sore. Your mouth gets cavities, the enamel erosion, gum disease, teeth sensitive to hot and cold foods. You can get a sore throat. You can tear and rupture your throat and have blood in your vomit. Muscles become fatigued. You can create stomach ulcers, pain. Your stomach can actually rupture and delay emptying. Skin can cause abrasions of knuckles and dry skin. You can create anemia in the blood, an irregular heartbeat, a weakened heart muscle, heart failure, low pulse, and low blood pressure. You can also cause dehydration, low potassium and magnesium and sodium. Your intestines can become constipated. You can have irregular bowel movements, bloating, diarrhea, abdominal cramping, and your hormones can become irregular or absent. My name is Courtney. I'm 19 and I suffer from bulimia. Treatments include establishing nutritional eating patterns. To do this, you may sit with the client during meals and snacks, offer liquid protein supplements, adhere to treatment restrictions, observe client following meals for 1 to 2 hours, weigh client daily in uniform clothing, and be alert for attempts to hide food. Also, you may help the client identify emotions and develop non-food related coping strategies such as self-monitoring using a journal and relaxation techniques. You may also help the client deal with body image issues by recognizing benefits of a more near normal weight, identifying personal strengths, interests, and talents, and also provide client and family education such as basic nutritional needs, harmful effects of restrictive eating, realistic goals, acceptance of body image, emotional support, avoid speaking about weight and food intake.
Mental health promotions include education of parents, children, and young people about strategies to prevent eating disorders, early identification and appropriate referral, as well as routine screenings of young women for eating disorders.
Bloopers! Bye, Felicia!